We'll do on cancer, a brief about what is cancer, different types of cancer, how does your genetics, gene mutations impact the onset of cancer, benign cancer, malignant cancer. Okay, different terminologies of cancers based on where their origin is. Okay, all these details we'll discuss. So that next week we'll do diet in cancer. Okay, diet in cancer, like diet cannot, no diet can cure cancer. Okay, but to alleviate the symptoms, to do symptomatic management, diet can have certain impact to make it easy for the treatments that are going on. The body stays healthy, the body stays nutritious. Okay, the body is not deficient. For that purpose, nutrition is important. Okay, and there is no diet that can cure cancer. Okay, so if anyone is joining late, please help them out with the topic name. So cancer is a disease in which some of the body cells grow uncontrollably, and it can spread to other parts of the body as well. If it is growing uncontrollably and it is staying at one place, we call it as tumor or benign tumor. But when these cells they spread from one part of the body to another, we call it malignant. Okay, cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and multiply through a process called cell division. It happens in everyone's body to form new cells. On a daily basis, this is happening on your body. Okay. When cells grow or become damaged and old, they undergo apoptosis. Apoptosis means the cells die by themselves. Okay. And new cells will take their place so that the part of the body performs the same function as it was doing earlier. Okay, so cancer can take place anywhere, but when this cell division and multiplication exceeds the normal pace and speed, that is what we call as cancer or tumor. Okay. Sometimes this orderly process breaks down and abnormal or damaged cells grow and multiply when they shouldn't. Okay. These cells may form tumors, which are lumps of tissue. Tumors can be cancerous or non-cancerous. Non-cancerous means they are not spreading; they are just stuck in one place. That is benign tumors. Okay, cancers or malignant cancers are the ones that spread from one point of the body to another. Okay, symptoms: fatigue, lump or area of thickening can be felt under the skin. Okay, if it is benign, weight changes, including unattended loss or gain of weight, skin changes such as yellowing, darkening, or redness of the skin, sores that won't heal, or changes to existing moles, changes in the bowel or bladder patterns or habits. Usually, normally, majority of the humans they empty their bowel and bladder movements early in the morning, but this pattern changes. Persistent cough or trouble in breathing, difficulty in swallowing, hoarseness in the sound, persistent indigestion or discomfort after eating, persistent unexplained muscle or joint pain, even without, usually when you are physically active, suddenly one day you are very much physically active. Okay, the next day you will feel soreness throughout your body, muscle pain, joint pain. So this is not like that. This is unexplained. You had your same routine, but unexplained muscle pain or joint pain pops up. Persistent unexplained fevers or night sweats, unexplained bleeding or bruising over the body. So these were the symptoms of cancer, more or less. Hoarseness is a rough voice, okay? Hoarse voice. The voice changes. It becomes more deeper, cracking noise, okay? Lots of cracks in the noise. Very rough, not a smooth voice, okay? That is hoarseness in voice. So causes of cancer. Cancer is caused by changes, mutations to the DNA within cells. The DNA inside a cell is packaged into large number of individual genes, each of which contains a set of instructions telling the cell what functions to perform, and as well as how to grow and how to divide. So all this information is inside the DNA, which is present in every cell. Okay, inside the nucleus of every cell we have the DNA, and with the help of this DNA the cells exactly know what it has to do in the human body. Okay, if there is any errors in these instructions that the DNA is giving to the cell, okay, it will stop its normal function and it can turn the cell to become cancerous. This is the baseline of how genetics, mutations, and your cells are linked. This is the symptom slide. You can take a screenshot if you want. So types of genes that causes cancer. Genetic changes can contribute to cancer, tend to affect three main types of genes. One is proto-oncogenes, tumor suppressor genes, and DNA repair genes. Okay. So either the combined function of these three genes or the individual functions of these three genes are responsible for some or the other factors that leads to cancer. So proto-oncogenes are involved in normal cell growth and division. However, when these genes are altered in certain ways or are more active than normal, they become cancer causing genes. Okay, they will control oncogenes are supposed to control the normal cell growth and division. But if some mutation goes on to this specific genes, okay, they will overdo the cell growth and division. That how you will get tumors or malignant cancers. Then tumor suppressor genes. These are also involved in controlling the cell growth and division. Okay, they are supposed to protect the abnormal, if at all any abnormal growth is gonna happen. These suppressor genes will suppress this abnormal growth from taking place. Okay, so cells with certain alterations in tumor suppressor genes may divide in an uncontrollable manner. Okay, so tumor suppressor genes, from the name itself you understand, these genes are present just to suppress any abnormal growth and division. Okay, so if something goes wrong with these genes, this function will be cancelled. Then DNA repair genes are involved in fixing damaged DNA. Okay, certain cells definitely will undergo mutation. Okay, and these repair genes are involved. They are available to make sure that whatever damaged cells are present, okay, they go there and repair the genes, repair the chromosomes, so that there is no duplications, any deletions in the chromosomes. If it has taken place, they repair those deleted parts. They will repair the duplications so that the body stays healthy. Okay, so together, these mutations may cause cells to become cancerous if DNA repair genes are not functioning properly. These repair genes are not able to fix the damaged DNA mutation. There is nobody stopping the mutation. Okay, it will lead to cancer. Is it clear to all the types of genes and how they are involved with cancer? What do gene mutations do? First of all, it may allow rapid growth. Gene mutation can tell a cell to grow and divide more rapidly. It creates many new cells that all have the same mutation, okay, all have the same damage. And these new cells that are growing, they are not functional at all. They are not functional like the previous cells. Okay, they are just growing and creating tumors there, and they are they more or less they will try to um, create barrier to the functionality and the physiology of the normal cells around them. Okay. Fail to stop uncontrolled cell growth. Normal cells know when to stop growing, so that you just have the right number of each type of cells in different parts of your body. Cancer cells lose the control that tell them when to stop growing. Okay, because tumor suppressor gene is not active. A mutation in the tumor suppressor gene allows the cancer to continue growing and accumulating without anyone stopping it. So that's how it grows. Benign tumors may become malignant, okay, and so on. Make mistakes when repairing DNA errors. That is, this happens when the DNA repair genes are not doing their function properly. Okay, DNA repair genes, they are looking for errors in the cell's DNA, and they have to make corrections immediately. Okay, and if they miss certain corrections, if they miss certain deletions or duplications, the mutation of the DNA will take place. Okay, there is nothing stopping the mutation, and it cannot and these errors, if they are not corrected, it can lead to cancer. What causes gene mutations? Okay, there are two main reasons. Either you are born with a specific gene mutation, okay, because this kind of gene mutation runs in your family, both your parents have it, or anyone in your family has it, and it is in your genetics, that this kind of, you are prone to have this gene mutation. Okay, this type of mutation accounts for a small percentage of cancer. And gene mutation that occurs after birth, most of the gene mutations occur after you are born and aren't inherited. A number of forces that can cause gene mutation, like smoking, radiation, viruses, cancer causing chemicals, like we call it as carcinogen, obesity, hormones, chronic inflammation, lack of exercise. So these all are gene mutations that can occur after birth, based on your lifestyle, based on what you surround your body with, okay, your environmental factors that you surround yourself with. Okay, these are the causative agents that could lead to certain mutations in your body. Okay. Then types of cancer. The first type, the most common type, is carcinoma. Carcinomas are the most common type of cancer. They are formed by the epithelial cells. Epithelial cells are found throughout the body. These cells cover your body inside and outside as well. Okay. And like your epidermis, you see your skin. Okay. Your skin is made up of epithelial cells. You see things under the skin. For example, your cheeks. Okay. You take the saliva sample from your cheeks, you will find epithelial cells. Okay. All your coatings of the nose, inside, outside, okay, everywhere you will find epithelial cells. There are different types of epithelial cells: basal cells, squamous cell, column uh, column like cells, okay, epithelial cells with villi, glandular cells which secretes mucus or other fluids. Okay, so there are different types of epithelial cells throughout your body. So carcinoma that begin in different types epithelial cell types have specific name. For example, adenocarcinoma, okay, cancer that that takes place in your glands or fluid producing epithelial cells. For example, the epithelial cells that line your that form the lining of your small intestine, that form the lining of your throat, okay, your esophagus, they all produce fluid, they all produce mucus. Okay, so even the stomach lining also has glandular epithelial cells that secretes hydrochloric acid, mucus, and other fluids as well. Okay, all the endocrine glands have epithelial cells because they produce hormones, okay, fluids that is used by the body. So any part of your body which is producing fluid, and the epithelial cells in that part of the body undergoes cancer, we call it adenocarcinoma. Okay, it means the glandular cells, the fluid producing epithelial cells are affected. Then we have basal cell carcinoma. it begins at the lower or the basal of the base layer of the epidermis, okay, which is the outer layer of the person's skin. Melanoma and all that comes through, that is a type of basal cell carcinoma. Then we have squamous cell carcinoma, that is under the skin surface, cheek. The epithelial cells you find in your cheek, and if you get wounded, okay, under the dermis you have dermis layer, okay. So squamous cells are found under the skin surface, under the epidermis, okay. So these are the different parts of the body where different types of epithelial cells are found, and whichever epithelial cells are affected, based on that names will also change, names for cancer will change. So this is about carcinoma. Then we have sarcoma. Sarcoma are cancers that form in the bone and soft tissues, including muscle, fat, blood vessels, lymph vessels, fibrous tissue such as tendons and ligaments. Okay, and osteosarcoma is the most common form of cancer of bone. You can see here a lump. You see, it does not move usually. This lump is not movable. So here, the bone tissue of the palm is affected. That is sarcoma. Your fat cells, your adipose tissues can also undergo sarcoma. Blood vessels, lymph vessels, muscles, tendons, ligaments in your body. If any mutations take place in this part of the body, it leads to sarcoma. Then we have leukemia. So cancers that begin in the blood forming tissues of the bone marrow are called leukemia. So these do not form any solid tumor, but they will form large number of abnormal white blood cells that are not functional. Okay, uh, and they are immature, usually immature white blood cells. Okay, they build up in the blood and bone marrow, crowding out the normal blood cells, and the low level of normal blood cells will be reduced, so that your body will not be getting enough amount of oxygen, and your body will lose out on healthy white blood cells, and you will fall sick very often. Okay, so you can see here the difference between normal blood and a leukemic blood. Normal blood has a lot of RBCs, red blood cells, few lymphocytes here and there, platelets here and there, but a leukemic blood is filled up with abnormal, immature white blood cells which are not even functional. Okay, so that's leukemia. Leukemia will not produce a solid tumor which is stuck in one place. Leukemia is the cancer of the blood cells. Blood cells are not in solid form, they are in cellular form, and they will be a part of the fluid connective tissue, that is blood. Then we have lymphoma. Lymphoma is the cancer that begins in the lymphocytes, T cells or B cells. These are the disease fighting blood cells and are part of the immune system. Am I audible to all? Am I audible to all? Is my voice clear? Is it breaking? Am I audible? Is my screen visible? Okay. So lymphoma, lymphocytes are affected here. So these are the disease fighting blood cells that are part of the immune system. Okay, not the blood cells that are produced in the bone marrow. These are the lymphocytes, the blood cells produced in the white blood cells produced in the lymph nodes. Okay, and the lymphoma, in lymphoma, abnormal lymphocytes build up in the lymph nodes and lymph vessels, as well as in the other organs of the body. And there are two main types of lymphoma. Hodgkin lymphoma, in which people with this disease have abnormal lymphocytes that are called Reed-Sternbach cells. You do not have to study all these names. Okay, these cells usually form uh, uh, they are these abnormal cells are formed from the B cells, B lymphocytes. And non-Hodgkin lymphoma, large group of cancer that start in the lymphocytes, grow quickly or slowly, and can form either B cell lymphocytes or T lymphocytes. Okay. Lymph nodes, you can see here in the image, the green dots that you see, these are the lymph nodes. Okay. Your body has specific places like the axillary part under your underarm, your neck region under the jaw. These are the areas, your inguinal region, okay, around the heart. Lots of lymph nodes are present. Lymph nodes are part of your lymphatic system. Okay, lymphatic system has lymph nodes. It has lymph vessels. Okay, they carry lymphocytes throughout your body. These lymphocytes fight infections. T cells and B cells are the lymphocytes. Okay, these are not produced in your bone marrow. It is produced from the lymph nodes. Okay, so cancer cells may develop in the thymus gland, lymph nodes, bone marrow, or spleen. Okay, and the tumor in the lymph nodes is called lymphoma, and it can produce abnormal T cells or B cells. If it is producing abnormal B cells, it is called Hodgkin lymphoma. If it is producing abnormal T cells, it is called non-Hodgkin lymphoma. Okay. Your lymph nodes are an integral part of your immunity. Okay. Then we have multiple myeloma. Multiple myeloma is a cancer that begins in the plasma cells. It's another type of immune cell, and abnormal plasma cells called myeloma cells build up in the bone marrow and form tumors in the bone all throughout the body. Okay, so bone marrow, you can see here, it is found within the bone. Okay, and they are producing plasma cells. Plasma cells are released into the bloodstream. So when they produce abnormal plasma cells, it is called myeloma cells. Okay, you can see here normal plasma cells and antibodies produced along with it, abnormal plasma cells, and a lot of abnormal antibodies surrounding it. So that is called multiple myeloma. Then we have melanoma. Melanoma is a cancer that begins in the cells that become melanocytes. Melanocytes uh, give pigment to your skin. Okay, so which are specialized in making melanin, and that is called the skin color. That gives our skin the pigment. Okay, most melanomas form on the skin, but some melanomas can form in the pigmented tissues also, like eye or any other part of the body which has pigment, which has melanin. Okay, in that part also melanoma can take place, but commonly melanomas are taking place over your skin, which is visible from outside. So these are the different types of melanoma. You can see in all these types, it does not have a proper outer lining. So the borders of the melanoma is not in a proper shape. Okay, that is one of the way how you can diagnose it, by looking at it. Okay, people who are Caucasians, white, okay, they are high at the higher risk of developing melanoma. Specifically, sun rays, sunlight, being exposed to sunlight for a long period of time, that could also trigger melanoma. So you have to always keep and watch for the moles in your body. Okay, so you may think that it is a mole, but it can turn out to be a melanoma, skin cancer. Then we have brain and spinal cord tumors. There are different types of brain and spinal cord tumors. These are named based on the type of cell where the tumor is formed. Okay, for example, astrocytic tumor, you have astrocytes in your central nervous system, and these astrocytes are supposed to protect your brain cells, to keep all the nerve cells and brain cells healthy. That is the function of astrocytes. And if the tumor is taking place in astrocytes, if there is an abnormal growth and development in the astrocytes, it will lead to astrocytic tumor. So even in your central nervous system, there are different types of cells in your nervous system. So based on where a tumor is formed, we have a different name for it. Okay. So that's all about cancer.